I'm Dr. Michael DeTola.
And I'm Megan Strong.
In our case of the week, a dentist shows us a great way to maintain the vertical on a full mouth case.
And then Polly won a crown? Watch in the first story as this parrot takes a crack at dentistry.
And in Texas, a family disturbingly finds they've purchased some cookies and K9's ice cream. That and more on today's Chairside Live. Hey now, hello and welcome to episode 136 of Chairside Live. Megan, how are you today?
Well, I'm doing okay. I'm sleep deprived.
Are you?
Eden has a stomach bug.
Oh.
And she threw up all over me at 1 a.m. last night.
Oh.
And we were up pretty much the whole night.
Wow.
So, little bit zombie-like, but thanks to coffee, I'm here.
Well, good for you.
Yeah.
And I was at a hockey game that went
Jealous?
into triple overtime.
Yes.
And the drunk guy next to me threw up on me.
No.
Yes, and I
James.
brought him home and took care of him. So I'm equally slightly exhausted.
Okay.
Just like you are, but for other reasons. I was. Sure. It was fun watching it, but the Ducks eventually lost to the Blackhawks.
No.
So it was a
I
little
watched
bit
it from
sad.
home.
So you had a little company then but it was over by 1.
Yeah.
You were on your own time then. All right, well, forgive us both for having dark sacks under our eyes and any mistakes we make while speaking today. We've got a good episode for you. We've got an interesting case of the week. We've got a doctor who really takes a logical approach to maintaining the vertical dimension on a full mouth BruxZir restoration case. So everything's been prepped on the upper and lower, and it's always difficult in those cases for dentists, or it's sometimes difficult for dentists to be able to take a good bite registration for us, especially in the case of something like this where we want to maintain the vertical dimension and we know the patient's comfortable with there. So let's take a look at what the doctor did to get a great result. I happened to see a case from a doctor who's doing a full mouth rehab, and he did a really good job of maintaining the vertical dimension. So when we want to maintain the vertical dimension on a case like this, we find one of the easiest ways to do it is with biotemps. So not only can you maintain the vertical or open it, even though he's going to maintain it on this case, but you can also have a very nice aesthetic result and have some strong temporaries that are going to look pretty good, especially if you're going to have the temps on longer than usual. Instead of the usual 2 weeks, maybe they're going to be on 4 weeks or 6 weeks or something like that. And so when we make the temporaries, we suggest to the doctors that we do it in 3 segments. So segment number 1, we'll have a temporary that entails these 2 bicuspids and these 2 molars. Then on this side, we'll have a biotemp for these 2 bis and these 2 molars. And then we'll have another biotemp for the 6 anterior crowns. By the way, you can see the wear that's on here and all the wear that's gone on in the patient's teeth. The patient's broke some PFMs before. So the doctor's doing this as a full mouth BruxZir rehab, assuming that's the only material that this patient won't be able to break. And considering these are all single unit crowns, I feel pretty strongly about that too. You know, you've seen us take a hammer and smash a BruxZir crown into a 2x4. The bridges, are not quite the same. We have the rule of 27 there where we get those extended spans. But for single units like this, I'm highly confident that if the doctor reduces enough, we will in fact have crowns that will be able to withstand this patient's biting forces. So again, 3 separate biotemps, one from that encompasses this side of the posterior, another one for this side of the posterior, and then the one for the 6 anterior teeth. And then of course the same thing on the lower. With 3 different segments where you've got the 2 bis and the 2 molars, the 2 bis and the 2 molars, and the 6 anterior teeth. And so when prepping these, you can start wherever you want. Sometimes it's fun to start in the anterior if you're not opening the bite, just to be able to get some aesthetic change there. But you could certainly start in the posterior as well as you wanted. And essentially what you're going to do, let's pretend we're going to prep these 4 posterior teeth too. So we're going to prep the 2 bis and the 2 molars. And then when we're done, before we take the impression, we're just going to reline those biotemps. But because only these 4 teeth are prepped and the rest of the teeth in the arch are unprepped, it's very easy to maintain the vertical dimension on those temporaries by just having the patient bite them into place while the reline material is on the inside of the temporary. So when it's all said and done, we now have prepped these 4 teeth. We have a biotemp that fits on here, ready to be cemented. Just like we were only prepping these 4 teeth. So, the same protocol as if we were just prepping these 4 teeth for crowns. Except when we're done, we can now come over and prep these 4 teeth for crowns. And when these 4 preps are complete, and we're ready for taking an impression, even though we're not going to take it at this appointment, We're now going to put these biotemps in place. You can set it in or you can actually cement them in depending on how far you're going to go today. And then we're going to reline these biotemps at that same dimension, again having these 6 teeth and these 4 teeth, these 6 natural teeth and the 4 with the biotemps on. If these biotemps were out, or we had to prep both sides at the same time, now we would just be hitting on these anterior teeth, which is a little sketchy for holding vertical dimension. So we're going to do it 4 at a time, reline the temps, 4 at a time, reline the temps, then prep the 6 anterior ones and reline these temps with both of these posterior ones in place. If you finish that all in one appointment, then, now that you've relined all 3 segments at the correct vertical dimension, you're free to take a master impression and then put these temps back into place. But typically that's a lot of work for the patient, and you're going to end up maybe just prepping the whole arch, getting the temps on, and having the patient back next time to pack cord and take the impression. So once that's done and everything's actually prepared, you end up with a full lower arch. Well, first of all, we got some impressions coming in from the doctor. So full arch trays, of course, because they're full arch preparations, so that's kind of absolutely necessary. And plastic trays, we certainly can work with that. Do we like metal a little better? Yeah, but we know we're splitting hairs sometimes. These types of impressions, the most difficult thing to do in dentistry. I mean, come on. That's when you're going to prep 14 teeth and they have to control the tissue around all of them and pack cord around all of them. This is more difficult than surgically placing a normal implant, more difficult than taking out an impacted wisdom tooth. This is as tough as it gets. That's why I like this to be its own appointment. And I also like to see what the biotemps are going to do to the tissue in case we have to drop some margin. So doctor takes 2 acceptable impressions, and then we get our uppers and lowers. And of course, the issue here is going to be how do we maintain the vertical between these if we're not going to open the bite. If we're going to have enough room to put these BruxZir crowns in place, if doctor's reduced enough, we want to maintain that same vertical if we don't need to add to the incisal edge length of, say, the central incisors or need more room. We know the patient's comfortable at that previous vertical, and the best way to be able to do that is to take the patient who's fully prepped at this point, and you can take the biotemps. They've all been relined on the lower just like they were on the upper at the proper vertical dimension. So we can put our biotemps in here and here on the bison molars and here on the bison molars. So when the patient bites together, they're at their normal occlusal dimension because the temporaries are in place. And then when they bite together, you just squirt a little bite registration in between here, which the doctor did. So intraorally, the upper and lower temporaries were here and holding the patient open at the right dimension here on the anterior. So once you have this bite, little segment here in the anterior, you will take out the temporaries over on this side, and we have the temporaries on this side still. Temporaries here are off, and we have our anterior bite. And now when the patient closes together, we have the same vertical dimension. We have our 2 pieces of bite registration and still the temps over here. And then lastly, we can have the patient open again, take out the temporaries on this side, and do 1 more bite registration in between these teeth. And because we had the temporaries segmented like that, we are able to do all of these at the same time segmentally. And so the vertical dimension represented by the 3 bite registrations is exactly the same as when the patient started off before they were prepared. So we've maintained it in the biotemps, and we've maintained it with the bite registration as well. So at that point, we can confidently mount it to these 3 bite registrations and then put the pin on the articulator and see how much room the doctor gave us. And we have plenty of room. We need 0.6 of a millimeter to do BruxZir minimally. So we can do 1.5 millimeters hammer test strength BruxZir on these teeth, upper and lower. And so that's a great job of the doctor holding this bite registration, holding the vertical, and making sure that we get an accurate bite to be able to go forward with this case and give him something, a full mouth case that he's not going to have to adjust for hours when he goes to seat this in the patient's mouth. And it was funny, sitting right next to it at the technical advisor's desk was this simple impression, not nearly as difficult as this one, just a simple little impression here for a single unit crown. But you can see how the patient bit down on the tray, and everything's twisted. And you can see how the teeth come up this way, and the patient was back together on the back of this tray, and then this part is completely twisted over here on the inside. And the patient had no chance of getting together. There's one of the teeth biting right there. And it just looks very warped and distorted the way the tooth looks. And so this is going to go back to that doctor. This is an example of what not to do on a relatively easy situation. And this is an example with these bite registrations of what to do on a much more complex case. So kudos, doctor. This case will hopefully drop in for you and need very few adjustments.
Gracias, Dr. D.
What? Oh, sorry.
Yeah, wake up.
I dozed
We're
off.
live.
I know, I'm exhausted.
Now let's go to a segment we call Viewer Mail. This week's viewer mail comes to us from Vermont, which is home of maple syrup and beautiful falls. And this comes from Dr. Arnold Chernoff. And he writes and says, Dear Dr. Datola, thank you for your videos. You're welcome. I enjoy watching them and learn something at each showing. I'm confused about the indications of cementing Lava Ultimate crowns with Ceramur cement. I thought you said Ceramur can be used as an all-around cement on any crowns. But when I spoke with a company rep, they said follow the manufacturer's instructions and they do not mention Ceramur cement. I just want to make sure that I heard you correctly.
Oh, that's a great question, Arnold. By the way, the only time I've seen the Northern Lights was in Vermont. We were on a vacation up there, a friend and I, after college, going through Vermont, New Hampshire, seeing like that part of the country where I haven't spent a lot of time. And we were outside one night, and we were staying in this big house, and it looked like somebody had a smoke machine pumping out green smoke, coming over this ridge of trees. It was the most unbelievable thing I've ever seen. It looked totally fake. It looked like a special effect from a movie, and have wanted to see it since, and have been in places like Iceland and never got to see it again. So
I'd like to see it.
It's kind of magical, like a unicorn.
Just like a unicorn.
These actually exist. So Arnold, I may have said that, and it's mostly correct if that's what I said, but ultimately you are correct, because you cannot, in fact, use Ceramur for every type of crown. What I probably was saying was that I use it for every type of crown that I use. And so I predominantly use zirconia, full contour zirconia, like BruxZir in the posterior. With BruxZir anterior now, I can use BruxZir all the way up to the front with some good translucency, or Emax crowns, for example, which are strong enough to be cemented. I don't do PFM single unit crowns anymore, but I still do PFM bridges, because those end up still being stronger than a BruxZir bridge. So even though BruxZir is very strong as a single unit, when you start to put multiple pontics in there, that is weaker than a PFM. And the reason is, when you look at the substructure of a PFM bridge, that metal, I mean, you can maybe think of one time where you've seen a metal substructure break, or maybe no times at all, and there's just nothing stronger than metal, even though it's an aesthetic compromise. What I don't do, and what most of our dentists don't do, is a lot of Lava Ultimate crowns or Vita enamic crowns, those kind of nano-filled resin-type, ceramic-type crowns based on whatever you think they are. But regardless, they have a flexural strength of somewhere around 250 megapascals. And so anything under 300 megapascals of flexural strength has to be bonded into place and can't be cemented. So whether it was an Empress crown, for example, which is down around 120 megapascals, that would have to be bonded into place, as well as Lava Ultimate, Vita Enamic, Suprinity, if it's not going to go in the oven. So there are some newer crown materials that aren't strong enough to be cemented and thus have to be bonded into place. And since Ceramur is a traditional crown and bridge cement and not bonding, it's just straight cementation, you are absolutely correct, and so is the rep, that Ceramur will not work. It's not strong enough for those, and the restorations could crack if they're not bonded into place on the tooth itself. And so as of today, Emax is the weakest crown, and it's at 360 megapascals of flexural strength, way above the 300 mark. And so Emax can be cemented. A lot of the Glidewell dentists that I speak with do cement it. A lot of my friends who are CEREC doctors bond them all into place. It really doesn't matter with Emax. You could go either way. You're going to want to bond it in place if you have a short prep, so let's say less than, say, 3 or 4 millimeters. And if it's got a taper of 35 degrees, that's a good indication to bond it into place rather than cement it. Or if you're doing Emax in the posterior and you don't have a full 1.5 millimeters of reduction, you will get additional strength by bonding that Emax crown into place on a molar versus just cementing it into place. So If I did say that, I was probably just referring to the crowns that that I do on an ongoing basis. But you're absolutely right. Ceramer would not be indicated for any of the types of crowns or restorations that are too weak to be cemented. And of course, Ceramer would not be indicated for veneers either, because a veneer prep's a totally non-retentive prep, and that's why we need to bond that into place. So you are absolutely correct. It should not be used for that. And with Lava Ultimate, you're going to bond that into place like you would those weaker crowns. And so a little more difficult there, but with the Ceramer, that definitely would not work. So thank you for bringing that up. I feel like we can never talk about that too much. And Megan has picked a gift for you, and it is the BruxZir Adjustment and Polishing Kit.
You know what, I have to say something. I just realized as you were answering his question that I have to apologize to Arnold, because when I was in my sleep-deprived state, when I was choosing the viewer mail, I mixed up where Arnold was from. The person from Vermont was a different letter. He's not from Vermont.
Oh, he's not?
No. But Vermont.
He was probably screaming at his computer about 4 minutes ago, going, "Oh wow,
I'm not from Vermont."
There's a guy with Maya. She's thinking of Ben and Jerry. That's probably what he.
Right.
Thought.
Oh,
Where is
gosh.
Arnold from?
I think he's from Indiana.
Oh.
Evanston.
Is this just another guess, or is it in his email? Does it say?
No, but it said in his web address something about Evanston. So I'm guessing that's Indiana, maybe? It could be Illinois.
Could be Illinois we're heading. Okay.
I'm sorry, Arnold. I really haven't slept in a year.
Somewhere in the Midwest.
Somewhere.
Somewhere probably between like Nevada on the west and say
York.
Ohio on the east. And maybe say Minnesota on the top,
Yes.
down to maybe Oklahoma on the
Yes.
south. In that box is where you will find Arnold.
But so please forgive me and accept this as an apology.
I'm sure he will. And Arnold, if you ever want to come on the show and reminisce about Vermont with us, we'd be more than happy to do that. Or other states you're not from. We could talk Hawaii with you, and you can regale us with stories about how great Hawaii is. Do you have a picture for him? You've had some interesting ones lately.
And I promise we'll send it to the correct address, not in Vermont. Illinois.
Illinois, there you go.
Well, I don't remember what I said. Indiana. They both start with I.
Right.
We've got this photograph, which I look skeptical.
I like that one.
Yeah.
That's
okay.
it.
Then that's the one we're using.
The contest is over. We're going with that one. Excellent. Good for you, Arnold.
Yes.
Any news today?
Yes. Here on Chairside Live, we featured some pretty inventive ways to pull a tooth. But here's a new one featuring a bird. In home video, we see a 14-year-old boy's pet parrot pull out his tooth. Apparently, this isn't the first time either. The boy says when he was 11, he fell asleep and the bird started picking at his teeth. When he woke up, the bird had his tooth in his mouth. After learning that oral bacteria from humans can be fatal in birds, the boy quit allowing the parrot to play dentist.
Yeah, Dr. Chernoff, I know.
What?
No, I know. Just watch the rest of the show. She corrects herself by the end. Yeah, I don't like Vermont either. All right. Bye-bye.
Stop it.
Wow, we have shown some interesting ways.
Yes.
Maybe some cruel ways. I'm pretty sure we've shown a couple ways of parents pulling teeth that might even violate the Geneva Convention.
Okay.
All to put them on YouTube. And you found this one on YouTube too. But this one I feel is kind of cute, is it not? Letting a bird
Weird,
kind of
gross.
Really?
Take your pick. I don't know.
So here he is.
Okay.
And he's on the kid's shoulder.
Right. Okay.
Kid looks a little like Justin Bieber, no?
No, absolutely not. But we'll take it. So here
Now,
he goes.
how does the bird
Right, how does the bird know?
which tooth? Dental school. That's how I know which tooth to take out.
Exactly.
I'm guessing that's...
So it takes him a couple tries, but he eventually... Okay.
See, the kid sticks his tongue up. He's in danger of losing that. Mm-hmm. I don't know. Is this really happening?
It is. Just wait. It's coming. Yeah. Look at him. Just get down there.
You don't feel like the tooth already came out and then they put peanut butter on the inside and like stuck it back in with something, like shoved it back in?
No, I don't think so. Look at it. He's just wiggling it out with his beak.
His beak looks a lot like some of the forceps that we use.
Got it.
Wow. Is that a blood-sensing bird? Like because the tooth is loose and the gingiva are bleeding a little bit?
I don't know. And why is this the second time that it's happened? And what would make right? Like what would make the bird say, there's my owner who's asleep.
Right.
Time to get in his mouth.
Exactly. And what if it decides that it develops a taste for eyeballs?
Right.
And the sister's sleeping, and then it pecks that out. But it's interesting that they're stopping it because human saliva can be dangerous to birds.
Yeah, they say that it can be very harmful and in fact fatal, which is interesting.
Right.
So you'd have to think that maybe that they wouldn't have enough good bacteria in their gut, so maybe they are clean.
Right. They could be, or just different maybe. But, Canadian geese, the ones that took down the U.S. Airway plane that Captain Sully had to land on the Hudson River, they're a big problem around airports. Thanks, Canada, by the way, for the geese. And but now that we know that, if you see a goose, and I'm talking to all Chairside Live viewers, spit in their mouth. Get as close as you can, spit in their mouth. Apparently, it can be fatal for these birds. That's my new campaign.
Okay.
I needed a cause, and now I have one.
Yeah, just devote yourself fully to that. I'm sure it'll go far.
Anything else?
Yep. A Texas family got a crunchy surprise in their Bluebell brand cookies and cream ice cream, and it wasn't a cookie. The father was enjoying his ice cream cone when he felt something hard. He spit it out and found a tooth with dried blood on it. They called the company, and it took them 2 days to respond. A company manager came to collect the carton and the tooth just hours before they publicly announced a recall for listeria-tainted ice cream, which resulted in 3 deaths. 2 weeks later, the family received a letter from Bluebell saying they had a dentist examine the piece of tooth and believes it to be the facial side of an adult premolar. They say they don't know how it got into the ice cream and gave them certificates for 2 free half-gallons of ice cream. Right?
You find a piece of a human body in your ice cream, and they offer you, first of all, more of that ice cream, and second of all, 2 half gallons. When they admitted that a dentist said it looked like the facial cusp of a premolar, I was like, you could just see the attorneys, cha-ching, with the little dollar symbols in their eyes, because they kind of admitted guilt by saying, yes, a dentist said this.
This was
here's
a tooth.
Some more.
We're not sure. And what's interesting, too, is that they gave them, okay, so here's some free ice cream. Oh, yeah, by the way, you're not going to be able to find it in any of the stores because it's been recalled due to listeria. So here's some free ice cream that you can't actually get.
That's, and it's just weird that it was just the facial and it had dried blood on it.
Right.
I don't know. I don't, it's a little weird that would happen, but it must have looked like enamel, I guess, to this dentist. I guess it could be a disgruntled employee. When I worked at Farrell's, a chain of ice cream parlors when I was in high school. I worked at Farrell's. Awesome. That was my first job. Oh. And we would have people eat 2/3 of an ice cream sundae and then throw a staple in there or throw whatever and then say, oh, and so we would take it off their bill. And so, but no one ever did tooth. No one ever went full tooth or finger. We never saw body parts. So I guess this could happen. But it also seems kind of Snopesy, like with the guy who reached in the Kentucky Fried Chicken and it had a tail. Right. Like the mouse. Or
the finger in the Wendy's chili.
Right.
I feel like we've seen this a bunch of times in different iterations. So it's like, was this placed here? We're not sure.
The premolar. Was there a parrot around? That's my other question.
Exactly. Are they neighbors with the boy with the parrot?
Right. Because the parrot, but they could have, plausible deniability. Parrot takes it out, flies over, decides it likes cookies and cream, drops the tooth accidentally while eating it. Yeah.
Well, you'd think that these kind of stories where there's recalls on food where there's listeria, salmonella, whatever, that it'd be easy to get a lot of money out of it if you're one of the people that falls ill. But actually, they were saying that it's very difficult because you have to go and get blood tests to determine that the strain of listeria is the same strain that was found in the food and whatever. I guess it's a very difficult process to actually get compensated for your sickness.
Any idea if Listerine kills listeria? Or is it made up of listeria?
I don't know.
I don't know either.
It's alcohol, actually.
I'm not a big Listerine fan. Yeah. Listeria, even less so.
Right. Not a huge fan.
But 3 people dying, that's pretty awful.
I know.
But
from ice cream.
The 2 things don't have anything to do with each other, right? The tooth and the listeria. It just happened to happen 2 days apart from each other.
And so that's why I guess they sent a company manager out to the people's house to retrieve the tooth and the leftover carton, I guess, whatever, to examine it. And I'm sure they were on high alert because they knew it was just hours before they announced the recall. So they obviously knew what was going on, and they wanted to take every precaution, I guess, that they didn't take before.
Well, I'll say this. If the family did not sue, they're pretty cool. If they were down with 2 half gallons, I'd be like, how about a year's worth? How about 4 gallons a month for a year, and we'll call it even. But if they didn't sue, I'm impressed because it was kind of no harm, no foul. I mean, it wasn't intentional. I just kind of hate like all these lawsuits where life just happens sometimes and people are always looking to get paid for it. So,
and this really just means that we love Vermont because Ben & Jerry's. This wouldn't happen with Ben & Jerry's.
No, there's been nothing more than a toenail found in anything of Ben & Jerry's that I've ever heard of. Well, that about wraps it up for this edition of Chairside Live. On behalf of myself, Megan, the CSL crew, and everybody here at the lab, I want to thank you for your time and your continued commitment to quality dentistry.
Stay classy. Sounded like a dog barking. Huh? Sounds like it was that way. Or maybe...
Well, let me ask you this. Who let the dogs out?
Woof, woof.
Hey now. Hell no. Hell no.
Hell no.
Hey
Hell
now.
no, we're not doing
Hell
this
no,
episode.
we won't go.
Is that okay? Yeah, it was. A Texas family got a crunchy surprise and a bluebell brand cookies cream ice cream and it wasn't a cookie.
Ladies and gentlemen, reading the news today, Cookie Monster.
See?
Oh, cookie starts with C. And what if it decides that it develops a taste for eyeballs?